Did you know that over 70% of injuries are linked
Ow!
to issues beyond the painful area? By the end of this video, you will understand the exact steps physiotherapists take to assess pain and dysfunction. Whether it's your spine, joints, or even your nerves, welcome back to PhysioFeed. The examination process is all about narrowing down possible causes of pain or dysfunction. Here's the blueprint. Determine differential diagnosis, identify predisposing factors, decide if counseling, treatment, or further investigations are necessary. Examination follows these general principles. A consistent approach ensures nothing is missed, focus on findings and their significance rather than the process. Comparing the injured side with the uninjured one helps identify abnormalities. Look beyond the pain to find contributing factors such as joint limitation or muscle tightness. A critical step is recreating the patient's symptoms. This may involve active and passive movements. For active range of motion exercises, look for restricted motion, pain onset points, abnormal movement patterns. Use combined movements in multiple planes to assess unexplained pain. Test with repeated quick or sustained movements if necessary. Palpation of tissues require precise anatomical knowledge. It helps assess muscle tone, spasm and tenderness, joint movement and ligament laxity. For ligaments, stress tests like Lachman's test or anterior draw test are gold standards. Palpation steps are listed on the right. Functional tests like running or specific sports activities. This helps pinpoint the root cause. Neurodynamic tests assess nerve involvement in chronic injuries. Common tests include straight leg raise, slump test, and upper limb neurodynamic test. Spinal issues often contribute to injuries. For upper limb pain, examine the cervical and upper thoracic spine. For lower limb pain, check the lumbar spine and thoracolumbar junction. Assess range of motion and palpate for abnormalities like hypomobility. Biomechanics play a huge role in overuse injuries. Here's what to evaluate. Observe for inefficiencies during activities. These are common injury culprits. Poorly suited gear like shoes or rackets can increase injury risk. Strength testing identifies weakness that may be injury related or predisposing factors. Always compare results with the uninjured side.